Hello and welcome to your Harrisburg Area Community College Blended Learning EMR program. James Weber here, wanted to give you a little bit of information on your chapter 4, Environmental Emergencies. When it comes to environmental emergencies, we're really speaking to what the body goes through when they are overexposed to the environment. So things like too hot, too cold, all things that will be covered under this chapter, right? So let's start with too hot. When a person is exposed to excess heat, the body's mechanisms for regulating temperature can be overwhelmed, right? You can get things like heat cramps, you get things like heat exhaustion, heat stroke, all things possible when it relates to overheating. Too much exposure to cold environments can do the exact opposite. Things like frostbite and hypothermia are possible, right? Also, we can have some additional challenges with things like submersion and drowning, especially cold water drownings. So we need to know how to respond to all these individual things. Heat cramps, right? Involuntary spasm of the muscles. They often occur after exercise, especially in hot weather. Mostly occur in the leg or the calf muscles themselves, right? When abdominal cramping occurs, however, so again, that's the leg muscles mostly. However, you do get abdominal cramping that can occur. It may occur after a patient's having an acute abdominal problem, so that abdominal cramping may be an indication of an underlying issue that goes beyond environmental. Treatment for heat cramps, biggest thing's going to be move the patient to a cold place, have a patient lie down in a comfortable position, and give them water to drink, right? Doesn't matter if it's cold water, warm water, shenanigans. Just give them water to drink. If the cramps don't disappear, the patient's young, old, or maybe they got some chronic problems, it's probably a good idea to have them transported, right? Give it time. Give it a good bit of water they might need in order for the cramps to go away. But if they don't go away and they fall within certain groups, it's probably not a bad idea to have them transported. Heat exhaustion. It occurs when a person's exposed to temperatures greater than 100 or greater than 80 degrees, usually in combination with high humidity, right? So high temperatures, high humidity, or both. It can also occur as a result of vigorous exercise at lower temperatures. Signs and symptoms, things like profuse sweating, lightheadedness, dizziness, nausea, weak pulse, low blood pressure, all things that would qualify as signs and symptoms of heat exhaustion. How do we address these? Biggest thing's going to be to manage the predisposing factors, right? Some absolute predispositions towards heat exhaustion. If you're real young or real old, if you've got some pre-existing medical conditions might make you susceptible to heat exhaustion. Certain medications, high ambient temperatures, and high humidity can all make you predisposed towards heat exhaustion. How do we treat it? Biggest thing is going to be, again, cool them down. And you'll see a theme in this chapter. When a patient's too hot, cool them down. When the patient's too cold, warm them up. There really is a lot of truth to that, right? Move the patient to a cooler place and treat them for shock. Unless the patient's unconscious, nausea, or vomiting, give them fluid by mouth. Monitor those ABCs and arrange for transport to an appropriate facility. Heat stroke. Heat stroke occurs when the body is subjected to more heat than it can handle, and the normal mechanisms for getting rid of this excess heat are overwhelmed. The patient's body temperature rises until it reaches a level where brain damage occurs. Signs and symptoms: flushed, dry skin, semi-consciousness or unconsciousness, and internal temperatures as high as 104 degrees. Treatment: maintain the patient's ABCs, remove the patient from the hot environment, remove the patient's clothes down to the underwear, soak the patient in water. If the patient's conscious and not nauseated, administer small amounts of cool water and arrange for rapid transport. It's a little bit of a graph that you'll find, Table 13.1 in your book, that just kind of talks about some of the differences between the two. So it'll give you a little bit of help on identifying whether they've progressed from heat exhaustion to heat stroke. You will identify the differences between the two with that symptomology. Frostbite. Frostbite can result when exposed part of the body are exposed to a cold environment. The following parts are susceptible most frequently: the face, the ears, the fingers, and the toes, right? Now, does it mean those are the only areas of the body that can be exposed? Absolutely not, but those are definitely the areas most susceptible. Depending on the temperature, the wind velocity, frostbite can actually come on really, really quickly depending on the time of year and where you are. So it's important that we're aware of its possibility. The most susceptible people are older folks, people with medical conditions, those who are exhausted or hungry, all tend to be people who are more susceptible to this. Superficial frostbite, right? This is when the affected body part becomes numb and turns a bright red color. Eventually, the area loses its color and changes to pale white. You'll see a progression where they begin to lose feeling and sensation. Warming the area must be done quickly and carefully, but don't rub the area by warming it because you can actually cause a pretty significant tissue breakdown. Superficial frostbites, of course, consider treating the patient for shock as well. It's a good point. A patient's skin for deep frostbite will be white and they will be waxy, right? And you can start to see skin becoming or remaining firm or frozen. Swelling or blisters may be present. Follow the scene size up primary assessment sequence in order to ensure that you're going to be protected as you need be. Deep frostbite. Remove any jewelry on the patient and cover the extremity with dry dressings. Why do we want to remove any jewelry? Because often with deep frostbite, you start to see swelling of the actual tissues. And when you swell the tissues and they are currently constrained by things like jewelry, you might actually see significant reduction in the amount of blood flow to that tissue or to that extremity or digit. We want to avoid that. Don't break any blisters that you see. Don't rub the injured area. Don't apply heat. And don't allow the patient to walk on an affected lower extremity, right? And again, this is deep frostbites. Our less deep, more superfluous frostbites, we can certainly warm those areas up, but just be mindful of avoiding heat in this circumstance. We should be warming up slowly, not quickly. Provide prompt transport. Some person we want to get to hospital pretty quickly because they tend to have better tools at warming patients up to go above and beyond what we've got. Hypothermia. Hypothermia occurs when a patient's body temperature drops to less than 95 degrees. The patient's body is not able to produce enough energy to keep the internal temperature at a satisfactory level. People most susceptible include people with inadequate or wet clothing and those who are weakened by illness, right? Certainly more susceptible for that hypothermia. Signs and symptoms: feeling cold, shivering, feeling of decreased level of consciousness, sleepiness, lack of coordination, mental confusion, slow reactions, and unconsciousness, all symptoms of hypothermia. These are some examples of the symptoms you might see depending on the patient's core body temperature. As you get colder, we start to slip and regress until the point where you can anticipate death at a temperature of less than 80 degrees. How do we treat these patients? Move them to a warm location. Remove that wet clothing. That's a big thing, right? Let's not make it worse by removing that wet clothing. Place warm blankets over and under the patient. If the patient is conscious, give them warm fluids to drink. If you do not have access to the building, let's get the patient into at least a heated vehicle to be able to start to warm them up. If transport's delayed, you may need to use your own body heat to warm the patient. Handle the patient gently. Hypothermic patients must be examined by a physician. Must be examined by a physician. Cardiac arrest and hypothermia. We talked about this during your CPR program, but if a patient's body temperature falls to less than 83 degrees, your heart may stop and you may need CPR. Should a patient be really, really cold, and that's the reason why they've gone into cardiac arrest, the traditional rules of downtime, right, don't really apply. We really want to try CPR and an AED on anybody who's been down from hypothermia, even ones who have been down and in cardiac arrest for a lengthy period of time, because the core reason why they are in cardiac arrest may very well be associated with that hypothermia, and these patients tend to have a much more remarkably higher success rate for resuscitation. Drowning and submersion. Each year in the United States, more than 3,000 people die from drowning. Drowning is the second leading cause of injury and death among children 1 to 14 years. And drowning is defined as suffocation because you're submerged in water and other fluids, and you're basically suffocating from that water taking over that open space in your lungs. Submersion injuries result from being beneath the water or another liquid, likely location, streams, lakes, swimming pools, and hot tubs as well. Wading pools, public fountains, or storm drain ponds do happen as well, although they're not as frequent. Common hazards for drowning in infants and young children. Bathtubs and toilets, things that we forget, as well as mop buckets that have been left out. These are areas that children can drown. Be mindful of that. Stages of drowning. New normal first stage is panic. Of course, the person becomes fatigued, injured, cold, or entangled. Somebody might see some loss of sensation and might become ill. That feeling of panic produces an inefficient breathing pattern. Signs and symptoms of that submergent injury: coughing, vomiting, difficulty breathing, respiratory arrest, cardiac arrest, broken bones, and hypothermia. Treatment of submersion injuries: make sure the scene's safe, make sure you're doing a primary assessment, call for additional resources like dive teams should it be appropriate. Perform a secondary assessment to check for other injuries, correct any problems in the airway, breathing, or circulation. Begin CPR if it's necessary. If the patient is breathing adequately, administer high-flow oxygen. Dry the patient off, cover with towels or blankets. Cold water drowning. Begin CPR on a drowning victim as long as the patient does not exhibit any definitive signs of death. When a person is submerged in cold water, the diving reflex will be activated. The protective reflex slows the patient's heart rate and the metabolic rate and decreases the body's demand for oxygen. This is in the process of trying to survive. The body tries to modify its behavior. I'll make sure that I post a pretty good video on specifically on mammalian diving reflex on this chapter. When you encounter a person who has been submerged in cold water, start CPR and continue it until the person has been delivered to a medical facility. Pretty important, regardless of circumstance. If they died because they got submerged in cold water, we've seen resuscitations of people who have been dead for as long as 6 hours successfully when they died in a cold water drowning. Lightning injuries. The electrical injury resulting in a lightning strike can cause cardiac irregularities and does cause cardiac arrest. Treat the patient by supporting those ABCs. More oxygen you can get into them. Defibrillate and CPR may be needed for some patients, right? And patients really must be going to a medical facility. Lightning injuries can cause electrical burns. These kind of burns are mainly internal. The extent of the burn damage will not be visible immediately after the injury occurs. Bites and stings, sometimes classified as environmental injuries or discussed under the topic of poisoning. In this book, bites and stings are discussed in Chapter 11, the Poisoning and Substance Abuse chapter. So a couple of different key points from this chapter, right? This is, again, a simple chapter on heat versus cold and overexposure to the elements. Heat cramps are caused by electrical light imbalance and dehydration. Person experiencing heat exhaustion sweats a lot and then becomes lightheaded, dizzy, and nauseous. Those are the initial symptoms of heat exhaustion. Heat stroke, however, is when it becomes remarkably worse, when a patient's been in a hot environment for too long and overwhelming the body's sweating mechanism. The body parts most susceptible to frostbite are the ears, base, fingers, and toes. Hypothermia occurs when a patient's body is not able to produce enough heat to keep the internal core temperature at a satisfactory level. And just be mindful of the idea that any patient who's brought to you, if they were hypothermic, they should be considered dead, right? Or they should never be considered dead. We want to treat these patients as always viable until they've been warmed in an appropriate facility. And drowning can occur in a lot of different settings, and lightning injuries are when we power and push a lot of electricity through the body. So this is, again, just a little bit of an overview of some environmental stuff. Make sure you do pretty good work in regards to the chapter. Know the vocab. My gosh, know the vocab. It's going to make a difference for your overall outcomes. And should you have any questions, we're always here from you. Feel free to push as much information as you can towards your program coordinator. We appreciate your time, your patience, your energy. We will look forward to seeing you in our next discussion. Have a great day.